Okay, so let's start off with nurses. As we know, nurses are the major caregivers of the sick patients, injured patients. So they're not, nursing is actually a very wide profession. They don't only take care of physical care of the patients, but they also meet mental and emotional needs of patients. And they're usually the ones that have a lot of contact with the patient more than anybody else in the healthcare profession team. All states, as we all know, require nurses to be licensed for that particular state to be able to practice the nursing professions. Now, we find nurses pretty much everywhere: hospitals, nursing homes, those in private practice, uh, ambulatory care centers or doctors' offices. They work in the community, they work in public health, they work in health departments, they work in migrant health centers, they work for school health. Um, they're otherwise, they're those who work in the school health field are considered public health nurses. So let's briefly talk about the academic preparation for nurses. Um, let's start with LPN, licensed practical nurse. They're also sometimes referred to as LVNs, licensed vocational nurses. We do have this program in BCC. I am not sure, though, how strong this program is, or if this is even there are plans to discontinue this program, or do we still even have it in operation? But it is a certificate program, 56 credit certificate program, and 22 of those are transferable to the Associates RN program at BCC. So the difference between an LPN and an Associates is that an LPN is a certificate program. Um, you actually do not get an academic degree, so it's a certificate. There are two types of 2-year RN programs. The first is the RN Hospital Diploma Program. So the RN Hospital Diploma Program is housed within a hospital's School of Nursing, like Montefiore, for instance, has this. Um, this is not awarded by an academic institution, therefore, this is a diploma. This is not necessarily an associate's degree. Whereas the RN that is awarded by community college, it is an academic degree. It is an associate's degree and therefore is transferable to other senior colleges if you want to proceed with your bachelor's degree. And of course, you have the registered nurse RN bachelor's degree, BSN. And that's the one that you get from a 4-year degree from senior colleges. On, on top of that, we have one type of non-physician practitioners, as we have talked about in the previous lecture video. The first one that we talked about is when we talked about the non-physician practitioners. And again, one of them are the advanced practice nurses. So these are nurses who are RNs with bachelor's degrees that proceeded to get their either master's degree, a Master of Science in Nursing degree, or a PhD or a DPN. PhD is a Doctor of Philosophy in Nursing, has a lot of research involved. DPN is more hands-on, very clinical, Doctor of Nursing practice. Now, the advanced practice nurses, there are 4 areas of specializations for them. So clinical nurse specialists are basically those nurses that have specific subspecialties, like OCNs, certified oncology nurses, for instance. Then you have certified registered anesthetists, nurse anesthetists, CRNAs. Then you have nurse practitioners. There are different types of nurse practitioners. Most of them actually are primary care providers. And then you have the certified nurse midwives. Again, as I have mentioned, in other countries, midwifery is an independent profession. I think there is a move to do that here in the United States, but for now, um, midwifery is sort of subsumed by the nursing profession. All right, let's start off with CRNAs. So you need to have a Bachelor of Science in Nursing, a BSN, and you have to have a current license as a registered nurse, of course. Most programs require floor nursing, especially in a critical care setting, like an ICU or maybe an emergency department, but usually it's an ICU. And then for you to become a CRNA, you need to pursue a master's degree, and it needs to be from an accredited nurse anesthesia educational program. And there are 115 in programs in the United States. Now, take note, we talked about accreditation, or we talked about the American Medical Association. Now, all programs include clinical training in the university or in large community hospitals. Now, most programs are based out of universities that have their own hospitals, such as like Columbia University, for instance. They have the Columbia Presbyterian Hospital System. And of course, after that, you need to pass the National Certification Examination after your graduation, and then the licensure will then be given on a state level. So nurse anesthetists work with surgeons, anesthesiologists, dentists, podiatrists, basically anyone who does surgery. So they take the place of physicians who are anesthesiologists. Okay, and it's right here. Anesthesiologists are those physicians that specialize in anesthesia. So they will be the direct supervisors of CRNAs. A lot of CRNAs actually practice with very high degree of autonomy. They're very independent, but on record, they have to be under the supervision of an anesthesiologist. They practice in just about any clinical setting that require anesthesia. So hospitals, delivery rooms, operating rooms, surgical centers, with dentists. We have nurse anesthetists in the military. So the average salary is about $76 to $80, and the average annual salary is like $160. And this, of course, this could be higher. The next type of advanced practice nurses rather, are NPs, nurse practitioners, and they're the largest categories of the APNs. They are required to obtain an RN and then a master's degree or doctoral degree. Although we now have those bridge programs, like Yale has them. Basically, anyone who wants to go into nurse practitioner school with any type of bachelor's degree, you have an extra year, and then they bridge you over to the nurse practitioner program. Nurse practitioners emphasize health education and promotion. So most of them take care of the routine primary care healthcare needs of patients. Their median salary is close to about $100,000. And then, of course, you have the certified nurse midwives. So they could either be midwives or RNs that basically got an advanced degree, such as a master's degree, in a midwifery program that is accredited by the American College of Nurse Midwives, and they have their own division of accreditation. Midwives have been in the United States for a very long time, close to 100 years. Notice that their salaries are not as high as the other advanced practice nurses, but this is probably going to change since there is a big demand for them, and they work alongside physicians who are obstetrics and gynecologists, OBGYNs. So they specialize in women's health and women's reproductive health. We all know that there's a shortage of nurses. Now, this fluctuates, and currently there is a shortage of nurses, and we continuously recruit from foreign countries. Um, it appears that this is due to uh, certain certain developments in the healthcare industry, such as the need for increased staffing ratio, meaning lesser patients for each nurse. Also, the overall growth of healthcare itself um, has increased the demand for nurses. All right, so now let's proceed to other health professions who have doctoral level degrees. First will be psychologists. They provide patients with mental health care. So the degree they have is either a PhD, a Doctor of Philosophy in Psychology, or a PsyD, or Doctor of Psychology. So you start off with a bachelor's degree, then you go to doctoral school, which is a graduate school. And of course, you take the GRE, the graduate record exam, before you get accepted into doctoral school. Their expertise is psychotherapy. Most states, if not all of them, don't really allow psychologists to prescribe medications. They are, however, well versed with these medications. Now, how is this degree different from a psychiatrist? Psychologists are non-physicians, so they did not go to medical school, whereas psychiatrists are physicians. They went to medical school and they went through residency training for psychiatry. So psychologists concentrate on psychotherapy and counseling, behavior change, screening, using diagnostic tools, and the interventions they do are more on what we call psychotherapy. Whereas psychiatrists also do psychotherapy, but in addition, they can actually prescribe medications. So that's the main difference. Okay, so psychiatrists are MDs or DOs. Psychologists are either PhDs or PsyDs. Psychologists are not physicians, while psychiatrists are physicians. The next health profession that has a doctoral level degree that we'll discuss are podiatrists. So podiatrists are doctors of the feet. They are actually surgeons as well, concentrating on the feet, and as such, they do have admitting privileges to hospitals because they could admit their patients in hospitals, and they'd be able to use the surgical or operating rooms in there. They can also prescribe medications and corrective devices. They also do physiotherapy. So, like I said, they could prescribe drugs, they could order lab tests, they perform surgeries. The training is actually, you could bridge your training into a medical residency program. So you could actually start off in podiatry school, and then if you get accepted, you could get into a residency program for surgery, general surgery. But most of them, they go to podiatry school specifically to become podiatrists. The next doctoral level health profession we'll discuss are chiropractors. And what they do is they do chiropractic manipulation, physiotherapy, and dietary counseling. So chiropractic manipulation is manipulation of the spine. Now, they're considered complementary practitioners, or sort of still outside of what we call Western medicine. So they focus on the misalignment of the spine, which therefore causes irritation of the spinal nerves that then causes the pain, which then interferes with normal functioning of the body. So they do not or cannot prescribe medications. So they don't prescribe drugs, they can't do surgery. Most of the approaches they have are holistic approaches like diet, exercise, rest, and of course, the main one is the chiropractic manipulation. So you need a 2-year degree before you could apply for chiropractic school. So with an associate's degree, you're actually qualified. Now, there are 17 private colleges that grant 4-year DC degree, chiropractic doctorate degree. And notice there are no public colleges or universities that grant this degree. Most of them are private. Now, you need a license from the state where you're going to practice. This has become really popular over the years, and insurance companies, including the government, Medicare and Medicaid, they actually pay for the services because patients swear by them, and patients actually believe in the efficacy of chiropractic medicine. The next one we'll talk about are optometrists. So optometrists are doctors of optometry. OD. Notice not DO, but OD. It's not overdose either. It's doctor of optometry. So what they do is they diagnose vision problems. They look at eye diseases. They can prescribe treatment, such as eyeglasses and contact lenses. Whatever prescription they write is nothing that you ingest, meaning not a medication that you will take or like swallow, or anything that's injectable. So it's something topical, like an ophthalmic ointment or an eye drops. So there are 17 programs in the country that train optometrists, and they do require licenses as well, and they have like this written clinical exams. So how is this profession different from ophthalmologists? So optometrists and ophthalmologists are both doctoral level professions, okay? But ophthalmologists are physicians. They are physicians that went to medical school and then they went to residency training for ophthalmology. The main difference between them, aside from ophthalmologists being physicians and optometrists as being not physicians, is that ophthalmologists actually perform surgeries. So the more complicated diseases of the eyes that require, say, surgical interventions like LASIK and things like that, it's the ophthalmologists that do that. Optometrists are sort of like your primary care provider for your eyes. They are your first line of defense. Now let's talk about allied health professionals. And we have to differentiate between technicians and assistants and technologists and therapists. So technicians and assistants, they receive about less than 2 years or 2 years of a certificate program or an associate's program. And they require supervision from therapists or technologists. What they do is they are actually the ones that carry out the plan of care of patients. But that plan of care usually comes from their supervisors who are technologists and therapists. So technicians and assistants usually get an associate's degree preparation, or they have a certification. Whereas technologists and therapists, they either have bachelor's, master's, or even doctoral training. So they're the ones that evaluate the patients, they diagnose the problems, they put together the plan of care, the treatment plan, and they then start off the treatment, but then these are carried out by technicians and assistants. So let's use one perfect example, for instance, between these two. So you have physical therapy assistants, PT assistants with an associate's degree. LaGuardia Community College is a good program for a PT assistant. Now, for physical therapy, you also have physical therapists, and they're the ones with the doctoral level degree, and that's the case in New York. Okay, so PT assistants and physical therapists who supervise them. We also have laboratory technicians, those with associate's degree, and we have medical technologists, those that have bachelor's, master's, or even doctoral degrees. This slide basically identifies four what we call therapeutic science practitioners. So there are different videos that would explain this professions, but let's talk about the main difference, especially with the first three. So physical therapists deal with gross movements of the body, whereas occupational therapists deal with defined movements of the body. So physical therapy would deal with like walking, raising an arm, while occupational therapists would be like picking up a spoon or a daily task like writing. Okay. Now, speech and language pathologists, on the other hand, not only deal with speech problems, they also deal with swallowing. And I encourage you, actually, you need to watch the videos regarding these professions after this lecture video.